Have you ever been told that you must accept a certain surgery after 70 without understanding the long-term risks? Many seniors feel pressured when a procedure is presented as routine or urgent. The language can sound convincing. It may even feel irresponsible to question it. But here is the truth. After 70, not every surgery that is offered is automatically the best choice. In this video, we are going to talk about 6 types of surgeries that seniors should approach with extreme caution. This is not about rejecting medical care. It is about understanding when the risks may outweigh the benefits. Stay with me until the end, because knowing how to evaluate these procedures could protect your independence, your cognition, and your quality of life. Now let's get started. Number 1, elective spinal fusion for chronic back pain. One of the most commonly recommended procedures for seniors with long-standing back pain is elective spinal fusion. On the surface, it sounds logical. If something in the spine is worn down or unstable, fusing the bones together should fix the problem. But after 70, the situation becomes much more complex. As we age, the spine naturally shows signs of degeneration. Discs thin out, joints stiffen. These changes can look alarming on imaging scans, even when they are part of normal aging. The danger begins when an image is treated as the problem itself, rather than your actual symptoms and daily function. Spinal fusion is a major operation. It requires anesthesia, significant blood loss risk, and a long recovery period. In seniors, healing is slower. Bone density may be lower. The stress on the heart and lungs during and after surgery is not insignificant. I once spoke with a 78-year-old man named Robert, who had struggled with back discomfort for nearly a decade. An imaging study showed degenerative disc changes, and he was told fusion would stabilize his spine. After surgery, the pain did not disappear. Instead, his mobility decreased during the long recovery, and he felt discouraged and dependent on others in ways he had never experienced before. This does not mean spinal fusion is never appropriate. There are cases of severe instability or nerve compression, where surgery is necessary. But for many seniors, especially those whose pain is manageable and not rapidly worsening, conservative options such as targeted physical therapy, strength training, weight management, and anti-inflammatory strategies may offer significant improvement without the heavy risks. If a surgeon recommends fusion, ask clear questions. What is the specific goal? What percentage of patients your age experience meaningful improvement? What are the risks to cognition, heart function, and long-term mobility? You deserve detailed answers. After 70, the decision to undergo a major spine operation should never be rushed. Stability is important, but so is preserving the independence and resilience you have built over a lifetime. Number 2, carotid artery surgery for mild blockage. Another procedure that is often presented as preventative and urgent is carotid artery surgery for mild to moderate blockage. The reasoning sounds simple. If the artery in your neck that supplies blood to your brain is narrowed, cleaning it out should reduce the risk of stroke. But after 70, the decision is not always so straightforward. Carotid surgery, whether it is endarterectomy or stenting, carries its own immediate risk of stroke, bleeding, and complications from anesthesia. In younger patients with severe narrowing and clear symptoms, the benefit may outweigh the risk. In seniors with mild narrowing and no recent stroke or transient symptoms, the balance can shift. The psychology here is powerful. Stroke is frightening. No one wants to lose speech, movement, or independence. When a test result shows a percentage of narrowing, even if it is moderate, it can create urgency and fear. Fear can cloud judgment. It can make a procedure feel like the only safe option, even when careful monitoring and medication might be equally effective. I remember a 75-year-old woman named Linda, who was told she had moderate carotid narrowing discovered during a routine screening. She had no symptoms. She was active, walking daily, and managing her blood pressure well. The recommendation for surgery came quickly. After seeking a second opinion, she learned that aggressive blood pressure control, cholesterol, management, and lifestyle adjustments could significantly lower her stroke risk without immediate surgery. For many seniors, especially those without clear warning signs, medical therapy can be remarkably effective. Blood pressure management, cholesterol-lowering medications, blood thinning therapy when appropriate, and consistent follow-up imaging may offer protection without exposing the brain to the stress of an invasive procedure. If you are told you need carotid surgery, ask whether you have had symptoms. Ask what the actual stroke risk is with and without surgery. Ask how many patients your age experience complications from the procedure. These are not disrespectful questions. They are wise ones. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 3, knee replacement for mild osteoarthritis. Total knee replacement has become one of the most common surgeries in America, and in many cases, it truly restores mobility. But after 70, especially when arthritis is still considered mild or moderate, it deserves careful thought before saying yes. As we age, joint cartilage naturally wears down. Stiffness in the morning, some swelling after activity, and discomfort. When climbing stairs can all be part of the normal aging process. An X-ray may show narrowing of the joint space or roughened surfaces, and it can look severe even when daily function is still reasonable. Knee replacement is a major procedure. It requires general or spinal anesthesia, cutting through muscle and tissue, and months of rehabilitation. Recovery demands strength, balance, and endurance. For a healthy 60-year-old, this may be manageable. For someone in their late 70s or early 80s with heart issues, diabetes, or frailty, the risk profile changes significantly. There is also the emotional component. Chronic knee pain can slowly shrink your world. You may stop walking as far. You may feel older than you truly are. When surgery is presented as a way to get your life back, it feels hopeful. Hope is powerful, but hope should always be balanced with realism. I once met an 81-year-old man named Thomas who had moderate arthritis. He could still walk a mile, though with some discomfort. His surgeon recommended replacement before the joint worsened. After surgery, he struggled with prolonged swelling and weakness. The rehabilitation was harder than he expected. For months, he needed assistance at home, and his confidence declined. Contrast that with another patient in her late 70s who chose structured physical therapy, weight reduction, muscle strengthening around the knee, and anti-inflammatory dietary changes. Her pain improved enough that she postponed surgery indefinitely. She regained stability without undergoing a major operation. The key question is not whether knee replacement works. It often does. The key question is timing and necessity. If you cannot walk across a room, if your pain is constant and severe, despite conservative care, surgery may be reasonable. But if you still function fairly well, strengthening the muscles around the joint can dramatically reduce stress on the knee. Muscles act as natural shock absorbers. After 70, preserving muscle mass becomes even more important. When you rely solely on surgical correction without building strength, you miss a critical layer of protection. Rehabilitation after surgery is not optional. It is demanding, and not every senior tolerates that demand equally. Ask your surgeon about non-surgical options. Ask about infection risk, blood clots, and long-term implant durability. Artificial joints can loosen over time. Revision surgeries in advanced age carry even greater risk. Your knees carry you through life. They deserve thoughtful care. Sometimes that care involves surgery. Sometimes it involves discipline, strengthening, and patience. Wisdom lies in knowing the difference. Number 4, coronary stent placement for stable heart disease. Heart procedures often carry an emotional weight unlike any other. When the word heart is mentioned, fear rises immediately. Coronary stents are commonly placed to open narrowed arteries, and in emergency situations such as a heart attack, they can be life-saving. But in seniors over 70 with stable heart disease and no acute symptoms, the benefit is not always as clear as it may seem. Stable heart disease means there is a narrowing in the arteries, but symptoms are controlled. You may experience mild chest discomfort with heavy exertion, or perhaps no symptoms at all. Modern medications, lifestyle modification, and careful monitoring can often manage this condition effectively for many years. Stent placement involves threading a catheter through an artery and expanding a small metal scaffold to keep the vessel open. While less invasive than open heart surgery, it is not without risk. Bleeding complications, kidney strain from contrast dye, rhythm disturbances, and cognitive changes from the stress of the procedure can occur. After 70, the body's resilience to these stressors is reduced. The psychological aspect is significant. When imaging shows blockage percentages, numbers can feel threatening. A 60% narrowing sounds alarming, but numbers alone do not determine outcomes. Research has shown that in many patients with stable disease, aggressive medical therapy can provide similar protection against heart attack compared to stenting. I recall an 82-year-old man named Charles who was told he had moderate coronary blockage discovered during evaluation for fatigue. He did not have crushing chest pain. He was still gardening and walking daily. A stent was recommended quickly. After a thoughtful discussion with a cardiologist who emphasized medication optimization and supervised exercise, he chose medical management. Years later, he remains active, with stable symptoms and no invasive procedures. Stents absolutely have their place. During an active heart attack, they can restore blood flow rapidly. In cases of severe lifestyle-limiting angina that does not respond to medication, they can improve quality of life. But for stable seniors, rushing into stenting without fully exploring conservative therapy may expose you to unnecessary procedural risk. Always ask whether your condition is stable or unstable. Ask whether medication adjustments, cholesterol control, blood pressure management, and structured cardiac rehabilitation could achieve similar results. Ask about your personal risk of complications given your age and other conditions. Your heart deserves protection. That protection sometimes comes from intervention, but sometimes it comes from patience, careful monitoring, and disciplined daily habits. Wisdom after 70 is not about doing everything possible. It is about doing what is truly necessary. Number 5, prostate surgery for mild urinary symptoms. Prostate surgery is frequently offered to men over 70 who experience urinary changes. Waking up at night to urinate. Occasional urgency. These symptoms can feel disruptive and frustrating, especially when sleep is already lighter with age. But accepting surgery too quickly for mild to moderate symptoms can introduce risks that many seniors do not fully consider. The prostate naturally enlarges as men age. This is not cancer. It is a common, often slow-moving change in the body. Imaging tests can show significant enlargement, and the numbers can sound alarming. But enlargement alone does not automatically mean surgery is necessary. The real question is how much those symptoms truly interfere with your safety and quality of life. Procedures designed to reduce prostate size can improve urinary flow, but they are not minor adjustments. They involve anesthesia, instrumentation through delicate tissue, and potential bleeding. After 70, anesthesia can carry a higher risk of temporary confusion, memory disturbance, and imbalance. Even short procedures can disrupt cognitive clarity for days or weeks. There are also functional risks that are often downplayed during brief consultations: urinary incontinence, retrograde ejaculation. For some men, these side effects can affect confidence and emotional well-being more deeply than the original symptoms. Consider a 77-year-old man named George, who was waking up 3 times each night to urinate. He felt tired and irritated. Surgery was presented as a quick solution. After the procedure, he experienced prolonged incontinence that required pads for months. His sleep improved slightly, but his independence and confidence felt shaken in ways he had not anticipated. Contrast that with another gentleman in his early 80s who approached his symptoms differently. He adjusted evening fluid intake, reduced caffeine. Over time, his nighttime awakenings decreased to once per night. No anesthesia, no surgical recovery. The key distinction lies in severity. If there is complete urinary retention, repeated infections, or kidney damage caused by obstruction, surgery may be clearly justified. But if symptoms are inconvenient rather than dangerous, conservative strategies often deserve a full trial before invasive action. Ask your physician how severe your obstruction truly is. Ask what percentage of men your age experience lasting side effects. Ask whether medication and behavioral strategies have been fully attempted. These are not confrontational questions. They are wise ones. Strength in later life often means choosing stability over speed. Number 6, aggressive cancer surgery for slow-growing tumors. The word cancer changes the atmosphere of any room. It triggers fear instantly. The instinct is to remove it immediately, to act decisively, to eliminate the threat. But after 70, not every cancer diagnosis requires aggressive surgery, especially when the tumor is slow-growing and localized. Certain cancers common in older adults, such as some prostate cancers, small kidney masses, early-stage thyroid nodules, or indolent lung nodules can progress very slowly. In younger individuals with decades of life expectancy ahead, aggressive removal may offer long-term survival benefit. But in seniors, the balance between surgical risk and potential benefit shifts. Major cancer surgery is physically demanding. It often involves prolonged anesthesia, significant physiological stress, extended hospital stays, and long recovery periods. In older adults, the risk of postoperative delirium increases. Confusion after surgery is not rare. For some seniors, cognitive function never fully returns to its previous level. Consider an 84-year-old man named Harold, who was diagnosed with a small, low-grade prostate tumor discovered during routine screening. Surgery was recommended immediately. He felt terrified at the word cancer. After seeking a second opinion, he learned that active surveillance was an accepted option given his age and tumor characteristics. He chose regular monitoring instead of immediate surgery. Years later, the tumor remained stable, and he continues living independently without having undergone a major operation. This does not mean cancer should be ignored. It means treatment must be individualized. The critical questions are, how aggressive is the tumor? How fast is it likely to grow? And how does your current overall health influence surgical risk? Many seniors assume that doing nothing is irresponsible, but active surveillance is not doing nothing. It involves careful monitoring, repeated imaging, and structured follow-up. In many cases, it allows a person to maintain quality of life without exposing the body to unnecessary trauma. After 70, quality of life often becomes as important as length of life. An aggressive procedure that extends survival by a small margin but significantly reduces independence may not align with every individual's values. Ask whether your tumor is low risk or high risk. Ask how likely the procedure is to affect cognition, continence, or mobility. These conversations may feel uncomfortable, but they are essential. Fear should never be the sole driver of medical decisions. Clarity should. If you're still watching this video and finding these insights valuable, please comment number 6 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Final thoughts. Reaching your 70s and beyond is not a sign of fragility. It is a sign of survival, wisdom, and resilience. You have lived through decades of change, challenge, and growth. That experience gives you something powerful. It gives you the right to ask questions, to pause, and to choose carefully. Surgery can be life-saving. It can restore function and relieve suffering. But it can also introduce new risks, especially when performed without clear necessity. After 70, the body heals differently. The brain responds differently to anesthesia. The heart and lungs recover more slowly. What once felt routine at 50 may carry heavier consequences at 80. The key lesson is not to reject surgery blindly. It is to understand your condition deeply. Ask whether the problem is urgent or stable. Ask how the procedure will affect your independence, your cognition, and your daily quality of life. Many seniors feel that questioning a recommendation is disrespectful. It is not. It is responsible. Medicine works best when patients are informed and engaged. Which of these 6 procedures surprised you the most? Which one made you think differently about how decisions should be made after 70? Reflect on your own experiences. Have you ever felt pressured into a medical choice without fully understanding it? Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.